Everyone desires a long and healthy life. When we think about longevity, we often assume that genetics play a decisive role. However, more and more research indicates that lifestyle and daily habits are actually the most influential factors in determining how long we live. In many cases, minor physical symptoms, such as persistent itching, can serve as early warning signs of serious health conditions. Especially in older adults, the appearance of abnormal itching in certain areas of the body after age 60 could be a sign that life expectancy is being shortened if not identified and treated promptly. A typical example is Mrs. Jiang, who at the age of 60 began experiencing a persistent itch in September. At first, she didn't think much of it, assuming it was caused by dry weather. However, as winter approached, the itching worsened, despite her use of various creams and ointments. She also began losing weight rapidly without any clear reason. Concerned, she went to the hospital for a checkup and was shocked to be diagnosed with lymphoma, a type of cancer that can cause prolonged itching. Mrs. Jiang was extremely surprised to learn that her persistent itching was related to lymphoma. Previously, she never imagined that a seemingly simple symptom like itchy skin could be a sign of a life-threatening disease. In reality, lymphoma is a malignant condition originating from lymphocytes, white blood cells that are present throughout the body, except for the hair and nails. As a result, lymphoma can develop in virtually any organ in the body. Medical studies have shown that when lymphoma develops, the malignant lymphocytes release biologically active substances like histamine, which are transported to the skin via the bloodstream. These substances irritate sensory nerves, leading to itching. About 20% of lymphoma patients report experiencing varying degrees of skin itching, ranging from mild to severe and unrelenting. A crucial point is that patients often struggle to distinguish between regular itching and cancer-related itching. However, cancer-related itching has three distinct characteristics. It appears suddenly without any warning signs. It persists despite the use of various treatments. The skin surface looks completely normal, with no rashes, redness, or visible lesions, and the weather doesn't significantly affect the itch. In addition, lymphoma may also present with other symptoms, such as persistent swollen lymph nodes, low-grade fevers in the afternoon, night sweats, unexplained pain, weight loss, and anemia. Recognizing these early warning signs is vital for timely diagnosis and treatment. If abnormal itching continues, it's important to seek medical attention as soon as possible. Although itchy skin is a common symptom and often not considered serious, if the condition persists without a clear cause and doesn't respond to conventional treatments, it could be a red flag for an underlying health issue. Especially for elderly individuals, itching in specific areas of the body should be given special attention. One area that requires attention is the armpit. Itchy armpits may be associated with diabetes. High blood sugar levels can impact the nervous system, particularly the autonomic nervous system, reducing the activity of sweat and oil glands. This leads to dry skin and subsequent itching. In overweight individuals with diabetes, excessive sweating in the armpits creates a moist environment that encourages the growth of bacteria and fungi, further aggravating the itch. Diabetes-related armpit itch often lacks visible rashes, tends to occur seasonally, especially in autumn and winter, and may spread to other parts of the body. The second area of concern is the anus. Approximately 75% of individuals with anorectal conditions such as hemorrhoids, anal fistulas, rectal cancer, or anal cancer experience anal itching. Initially, the itch may appear on one side of the anus with mild discomfort. However, if left untreated, it can worsen, become widespread, and intensify at night, significantly affecting quality of life. The third area is the genital region, particularly in women. Itching in this area is often related to gynecological issues such as vaginitis, vulvitis, genital eczema, genital warts, or scabies. For example, vulvitis causes itching due to an imbalance in vaginal flora, allowing harmful bacteria to proliferate and disrupt the vaginal environment. Vulvitis-related itching may also involve a burning sensation or pain during urination or defecation, and tends to worsen with scratching, leading to prolonged discomfort. If elderly individuals experience unexplained itching in these three regions, it's crucial to seek medical evaluation and treatment promptly to avoid serious complications. Another area where older adults frequently experience itching is the lower legs. This can be a sign of hypothyroidism. When thyroid hormone levels drop, metabolic activity slows, leading to dry and dehydrated skin, which triggers itching. The lower legs, having fewer sweat and oil glands, are especially vulnerable to moisture loss and become more sensitive. People with hypothyroidism often report a tingling sensation, peeling skin, and coldness in the lower legs, especially during the cold and dry autumn and winter seasons. Let me know if you'd like this translated back into Vietnamese or adapted into a shorter summary. In addition, Dr. Wang, deputy head of the dermatology department at Wangjing Hospital, part of the China Traditional Medicine Academy, stated that itching in the elderly can be classified into two main types: dry itching, due to aging, and moist itching, related to diseases. Dry itching is a common condition in older adults, often caused by a decline in the activity of sweat and oil glands with age, making the skin more prone to dryness, peeling, and itching, especially during dry weather or when the body is dehydrated. On the other hand, moist itching is often a sign of underlying health problems such as liver dysfunction, kidney issues, high blood sugar, or moisture in the genital and anal areas. When the liver and kidneys become weakened, the body's detoxification ability decreases, causing toxins to accumulate in the blood and manifest on the skin, leading to itching, darkened skin, rough texture, swelling, and susceptibility to secondary infections like folliculitis or lymphangitis, which could even leave scars. Scratching provides temporary relief, but does not address the root cause of the itching. In fact, excessive scratching can damage the skin, making it red, sore, and prone to infections. Therefore, elderly individuals who experience prolonged itching, especially in the legs, should proactively seek medical advice for an accurate diagnosis and proper treatment. Scratching is a natural reflex that helps relieve the feeling of itching, but it only offers temporary comfort without tackling the underlying cause. If overused, it can damage the skin, causing redness, roughness, dark spots, and the risk of secondary infections like folliculitis or lymphangitis. These skin damages not only cause pain, but can also lead to permanent scars, which can severely impact quality of life, especially in elderly individuals with weaker and more sensitive skin. To control and prevent skin itching, especially dry itching, which is more common than moist itching, lifestyle changes and proper skin care are essential. First, a healthy diet should be prioritized. Limit the consumption of spicy, oily, sugary, and raw cold foods. Instead, include foods rich in manganese, such as radishes, cabbage, sweet potatoes, and foods rich in vitamins like animal liver, carrots, potatoes, and mushrooms to nourish the skin from the inside out. In addition, proper skin care is crucial. Older adults should ensure they get enough sleep, avoid staying up late, and reduce scratching to prevent skin damage. During the autumn and winter seasons, when dry itching is more likely, bath frequency should be reduced, and hot water or strong soaps should be avoided. After bathing, moisturizing creams should be applied to retain moisture in the skin. When washing the face, cold water can be used to tighten pores and maintain hydration. Lastly, attention should be paid to the living environment. Keep indoor air humidified, limit exposure to allergens, and always listen to your body. If itching persists, it is essential to seek early medical attention to detect underlying health issues and receive timely treatment. In summary, skin itching is not a disease but a symptom reflecting the health status of the skin and the body. Particularly in older adults, prolonged, recurring, and unexplained itching may be a warning sign of serious underlying health issues, such as lymphoma, diabetes, thyroid disorders, liver-kidney dysfunction, or anorectal and genital diseases. Although skin itching is a common phenomenon, if it does not improve despite treatment, or is accompanied by symptoms such as weight loss, mild fever, swollen lymph nodes, night sweats, etc., one should not be complacent. Proactively visiting a doctor early can help detect the disease at an early stage, thereby improving treatment effectiveness and increasing life expectancy. Everyone, especially the elderly, should enhance their awareness of body care and listen to any abnormal signs. Additionally, it's important to maintain a healthy lifestyle, eat a balanced diet, care for the skin properly, and keep the living environment clean and airy. Finally, never ignore small areas of itching. Sometimes these seemingly simple signs can be important warnings that your body is sending.